Is your dog throwing up undigested food? When that happens, are they actually vomiting or are they regurgitating? It might seem like a minor distinction in the moment. But when veterinarians use those words, they mean two very different things. And understanding the difference can tell you a lot about what's going on inside your dog's digestive tract. If the food looks almost exactly like it did before it went down, that detail matters. Let's break down why dogs bring up undigested food, what it means, and how you can support them. Welcome to Bernie's University, the free online learning zone for dog lovers, brought to you by Bernie's Best. I'm Bernie, the inspiration behind our science-backed supplements. The better you understand your dog, the better you can take care of them. I'm here to help. Let's start with definitions. Canine vomiting is when your dog expels food or liquid from the stomach or upper small intestine. It's an active process. You'll usually hear it coming, retching, abdominal effort, that distinct warning sound before it happens. Regurgitation is different. It's not really propelled by stomach or intestinal muscles. Instead, the material comes right from the esophagus, the tube that carries food from the mouth to the stomach. Regurgitation is different. It's not really propelled by stomach or intestinal muscles. Instead, the material comes right from the esophagus, the tube that carries food from the mouth to the stomach. Because regurgitated food never made it to the stomach, it hasn't been exposed to acid or digestive enzymes. That's why it often maintains its original shape, texture, and even smell. No breakdown, no bile, no sour odor. That visual difference is one of your most useful clues. Regurgitation usually happens quickly and without warning. There's often little to no retching beforehand. It usually happens shortly after a meal. And here's why veterinarians take repeated regurgitation seriously. Normally, swallowing and airway protection work together in a coordinated way. If food comes up suddenly, that coordination can be disrupted. In some cases, material can enter the airway instead of being swallowed properly. That can irritate the lungs and lead to complications like aspiration pneumonia. That's why regurgitation, especially repeated episodes, should be evaluated. Your veterinarian may perform a physical exam, blood work, or imaging to rule out underlying causes such as hormonal disorders like Addison's disease, parasites, or structural disorders of the esophagus. This isn't about assuming the worst. It's about ruling out things that need urgent attention from a professional. To understand why food comes back up, it helps to understand how digestion normally works. When your dog eats, food travels down the esophagus and enters the stomach. In the stomach, strong acid and digestive enzymes begin breaking food down. From there, partially digested material moves into the small intestine for nutrient absorption. Then into the large intestine to form stool. If food never reaches the stomach or doesn't stay long enough to mix with acid and enzymes, and it won't break down. That's why regurgitated food often still looks whole. Digestion simply never progressed far enough. So why would food fail to reach or stay in the stomach? The most common reason is surprisingly simple: eating too fast. When a dog wolfs down a meal, the esophagus may not efficiently move food downward. Food can come back up the way it entered. Eating too much too quickly can also overwhelm the system and cause the body to reject excess intake. You might have seen videos of dogs eating in what looks like a little high chair. They have megaesophagus, a condition where the esophagus dilates and cannot effectively push food into the stomach.
Because the esophagus is enlarged and weak, food can sit there and come back up.
Many dogs with this condition are diagnosed early in life and may need to eat upright in a special chair so gravity can help move food downward. Food allergies and intolerances can irritate the digestive tract. Common allergens include wheat, dairy, beef, and chicken. Parasites like roundworms, hookworms, and whipworms can also cause vomiting, regurgitation, diarrhea, and weight loss. More serious causes can include kidney disease, ulcers, toxin ingestion, motion sickness, stress, or anxiety. Occasional throwing up may not be alarming. Repeated episodes always require veterinary evaluation. If your dog has a single regurgitation episode, you can help settle their stomach by withholding food for a few hours. Offer water or ice cubes to keep hydration levels up. You can try to reintroduce small amounts of their food to see whether your dog can keep it down, instead of giving them their full portion. If regurgitation or vomiting continues, or if you see blood, bloating, weakness, or repeated unsuccessful attempts to throw up, seek veterinary care immediately. A swollen abdomen combined with distress can indicate gastric dilatation volvulus, which is life-threatening. If something feels off, call your veterinarian. How can you help your dog if they occasionally regurgitate, but it's not an emergency? For many dogs, regurgitation isn't uncommon and often happens because they eat too fast, eat too much, or have inconsistent digestive movement. After medical causes are ruled out, strengthening the gut foundation can make a meaningful difference. Start by slowing down how quickly they eat their meals. Use puzzle feeders. Offer smaller portions. Encourage calmer feeding routines. Then support digestion internally. Bernie's Perfect Poop is a complete 4-in-1 digestive support supplement. 2 key types of fiber, soluble and insoluble fiber from natural plant sources, miscanthus grass, pumpkin, and flaxseed, help support healthy movement through the digestive tract. Hardy spore-forming probiotics help maintain microbial balance. Prebiotics feed those beneficial gut bacteria. Digestive enzymes begin breaking food down efficiently from the first bite. When food is breaking down properly and moving at the right pace, there's less digestive disruption.
And less disruption means fewer unexpected episodes.
Perfect Poop is easy to sprinkle onto every meal. No juggling multiple products. Just consistent, daily digestive support. Because when health starts in the gut, everything else tends to follow. If your dog is bringing up undigested food, step back and look at what you're actually seeing. Did the food reach the stomach? Or did it come back up before digestion even started? Vomiting and regurgitation aren't interchangeable terms. They describe different processes in different parts of the digestive tract. And here's why veterinarians care about this distinction. When a dog is vomiting, we're usually thinking about a problem in the stomach or intestines. When a dog is regurgitating, we're thinking about the esophagus. Those are different parts of the digestive tract. They point to different underlying causes. They require different diagnostic approaches. And they can carry different risks. For example, regurgitation is more commonly associated with aspiration because food can enter the airway when it comes back up suddenly. That's why using the correct term isn't just semantics. That distinction helps you decide what to do next. Rule out medical causes first. If everything checks out, then look at feeding habits and digestive support. Slow the meals down. Support the gut. Be consistent. Most of the time, when digestion is working properly, food moves in one direction. And that makes life easier for both of you, so you can spend less time cleaning up gross messes and worrying about your pup, and get back to spending quality time together. If this helped, I've got more videos that go deeper into dog digestion and gut health. Click right here to keep learning how to support your dog the smart way. And please subscribe to get more simple, science-backed dog health videos from Bernie's University.